cataract surgery. It's the most common surgery in the world, and that's when we remove that cloudy lens that's become a cataract and replace it with a lens implant. It's a very quick procedure. It's done under topical anesthesia with a little bit of relaxing medicine through an IV. You're not deep asleep where you need a breathing tube, or you're all the way out. You're comfortable through the process. You don't see sharp things coming at you, which I know is a fear that a lot of people have. It's a comfortable procedure. You feel cool water flowing through our instruments. Through tiny, tiny little incisions into the front part of the eye, we break the cataract up with a gentle ultrasound device and vacuum the cataract out in small pieces. The lens implants that we use, they fold up almost like a taco, so they fit into an extremely tiny incision. If you think of your cataract like this big thing, it doesn't take a big incision to get the cataract out like it used to. Tiny little incisions. 99% of the time, this is a no suture surgery with very quick healing time and recovery.